Hey, what's up YouTube? Welcome back to Intuition. In this week's video, we're going to go over 3 counterintuitive concepts in healthcare. Stay tuned. Alright, so in this video I wanted to go over counterintuitive concepts because these types of concepts are critical for us to understand why they actually are contrary to what we might think. That is what allows us to become experts, and it gives us the knowledge that we need to better advise patients about how to maintain good health. And also, these types of counterintuitive concepts are the types of questions that many students get wrong on exams because they actually run counter to what you might think from just analyzing the questions at first glance. Okay, so with that said, let's dive into these 3 questions. Question number 1. Question number 1 states, a patient with hyperthyroidism would most likely experience the following symptoms. So this question is basically asking us about a patient who has hyperthyroidism, and each answer choice talks about whether or not TSH is increased or decreased. So that would be the first thing I will look at to eliminate wrong answers. The TSH is what is actually counterintuitive when it comes to hyperthyroidism, because what is TSH? TSH is thyroid stimulating hormone, right? That's what TSH stands for. In this case, this patient has hyperthyroidism. Well, we know what the word hyper means, right? It means very active, right? Like a hyper child. So if a patient thyroid is very active, you would think that, well, their TSH must be very high because something has to be stimulating their thyroid to be overacting. And TSH is thyroid stimulating hormone. That's the hormone that would stimulate the thyroid to become more active. So therefore, a patient with hyperthyroidism must have a very high TSH. You see how plausible that argument sounds? But it's actually incorrect because you're putting the cart before the horse. TSH is actually a hormone that is released by the pituitary gland in response to low thyroid activity. When the pituitary gland notices that there is very low activity from the thyroid gland, that means that you are moving away from homeostasis, from having a normal acting thyroid. Then your pituitary gland responds by releasing TSH. So really, your TSH is only going to be high if your thyroid is not active. So it's the opposite of what you might think. The converse of that would be that if your thyroid is too active, then your pituitary gland is not going to release TSH. So the TSH would be low if the thyroid is very active. Now, just by understanding that counterintuitive concept, we can eliminate the answer choices that have elevated TSH. So A and B are incorrect. So the answer would be C or D. So let's pick between C and D. C says hot flashes, tremor, fatigue, weight loss, diarrhea. What do you guys feel about those answer choices? The thyroid helps to regulate the metabolic rate of our bodies. If your thyroid is very active, then your body is very metabolically active, which means that you're producing heat. Your body is very active, which means you're gonna sweat, you're gonna feel tired, your body is just burning energy for no reason. And on the other hand, if your thyroid is underperforming, then you get the opposite side effects, right? You feel like you don't have any energy, you gain weight easier because your body isn't burning energy. Instead of getting diarrhea, you get constipation because it takes energy for your body to defecate. With that said, the answer would be C. The answer choices in C shows hyperactivity. If you have hyperthyroidism, you're going to have high activity. So the answer would be C. High activity and low TSH. So C is the right answer. Okay, let's go on to question 2. Question number 2 states, which of the following patients likely suffer from nutritional deficiency? Type 1 patient is a patient who is malnourished with a poor diet. Type 2 patient is a healthy female patient who takes a daily multivitamin. Type 3 patient is an obese patient who mostly eats fast food. When you take a look at nutritional deficiency, the first picture that probably comes into your head is a starving child. You get your nutrition from food, and if you're not eating enough food, then you're going to be nutritionally deficient. That's just common sense. But what about the other 2 answer choices? The healthy female who takes a multivitamin. Keyword in that statement is healthy. Chances are this patient gets adequate nutrition, and she also takes a multivitamin, so probably won't have vitamin deficiency either. So probably not this patient, right? Okay, now what about the obese patient? A patient who mostly eats fast food. A patient like this would be a patient who would probably have a deficiency because a lot of times fast food are very lacking in other types of nutrition. You know, they're lacking in fiber and some other types of minerals, right? And we know from our experience as pharmacy students, it's very common for obese patients to have vitamin D deficiency. You might say that doesn't make sense. Why would an obese person have nutritional deficiency? There are different reasons for a patient to be obese. Obesity is not always tied to nutritional intake. In order for you to maintain a healthy weight, your body has to burn enough energy for you to maintain a low body weight. And what allows our bodies to burn energy? Well, we have different things. You can exercise, which will be something that is in your control, but there are also other factors. Factors such as we just talked about thyroid activity, right? If you have a thyroid that is underperforming, your body's metabolism is just going to be low. And if your body's metabolism is low, it's going to be much harder for you to lose weight. Your body is just refusing to burn energy. And what allows the thyroid to function? We know that the thyroid relies on minerals, right? Biggest one would be iodine. And not only the thyroid, but for skeletal muscles to contract, we know that that relies on vitamins such as calcium, potassium, magnesium. And if you're deficient in these chemicals, it can lead to weight gain and fatigue and a lack of activity from your body. It's very common for an obese person to have nutritional deficiency. And it's kind of counterintuitive, but it's true. So, which two patients would you expect to have nutritional deficiency? Definitely the malnourished patient and also the obese patient. So that would be answer choice B, 1 and 3. All right, let's go on to question number 3. Okay, question number 3. Question number 3 states, Prednisone is a corticosteroid used to treat the inflammatory response of various autoimmune diseases. What impact does prednisone have on white blood cells upon initiation? So we're talking about a drug, prednisone. And prednisone is an anti-inflammatory type drug. It's a steroid, hyperinflammatory response of autoimmune or inflammatory diseases. Now, what is an inflammatory response? So when we think about inflammatory response, we think about redness and soreness. And why does the body turn red and cause soreness? Well, that is a response to something insidious that's occurring in your body, right? For example, if you smash your hand will bruise, it'll turn red and it'll be sore. Why does it do that? Well, your body does that as a way to help fix the damage that has occurred. Inflammatory response results in more blood flow to that area, which is why it turns red. Then it also releases cytokines and other chemical signals that tells the brain, hey, there's some pain here, there's something going on here, and we need to fix this. And therefore, an inflammatory response is triggered where there's an increased amount of blood flow, there's an increased amount of white blood cells there, which is used to fight infections. In case that, bacteria happen to penetrate that area, then white blood cells come in and help fight the infection in that area. Okay, so now the drug prednisone comes in and fights this inflammatory response. So the prednisone is actually fighting your body. Since you know that prednisone will fight your body, then you would say, well, definitely prednisone will have a negative effect on the white blood cell count. It will decrease the amount of white blood cell count because the white blood cells is a big component of inflammation. And if prednisone fights inflammation, it's also going to fight the white blood cell, which is true. But there's a catch here, right? This is where the counterintuitive part of prednisone comes in. Prednisone will fight the inflammation and lower the white blood cell count, but that's only after long-term use of prednisone. Upon initiation of prednisone, the opposite effect actually occurs. And why does that occur? It occurs due to a phenomenon known as demargination. What is demargination? The white blood cells in your body are not all just floating around in the bloodstream. A lot of the white blood cells are actually stuck onto the blood vessels and onto the cell surfaces. Now, what happens is that the demargination effect of prednisone causes a lot of the white blood cells to detach from the blood vessels and enter the bloodstream. So if you give a patient prednisone and you take a blood level after a period of time, you'll notice that their white blood cell count goes up. But it didn't really go up. It's just that the white blood cells moved from off the vessels and went into the bloodstream. And this elevation will occur for about 2 weeks. And after about 2 weeks, then the white blood cell count will start to decrease. Upon initiation of prednisone, it would actually increase white blood cell count, which is a counterintuitive concept. So the answer here would be answer choice B. It would increase the level of white blood cells. All right, so there you have it. I hope that this video was helpful for you guys. Always trying to educate you and teach you big concepts, because what you remember, what you retain is what you understand. And that is the heart and the focus of this channel. So hope you guys continue to watch. If you're new to this channel, go ahead and hit the subscribe button, hit the notification bell, and look out for our videos every week, every Wednesday. Stay tuned, and I'll see you guys next week. Bye-bye.